Judging by the number of people foregoing masks at large sporting events here, Ontario seems to be over COVID. However, the numbers show that we're well into the sixth wave, with a recent spike in cases adding to the estimated 5 to 6 million Ontarians who contracted Omicron since December. The difference from earlier in the pandemic? Hospitalization numbers have stayed low. Still, one recent statistic is drawing a fair amount of attention. For a time, reinfection was considered rare. Yet over the past 6 months, almost 12,000 Ontarians have caught COVID for a second time, the majority between the ages of 20 and 59.
I think a lot of people were lulled into believing that, if they caught COVID, they would be fine forever. And the reality is, there's a few things working against that.
For one, he says the virus keeps mutating, so antibodies from one variant won't work as well for another. Also, only 47% of Canadians are triple vaxxed. And while it was originally believed catching COVID could provide years of immunity, recent studies have shown 4 to 5 months is more accurate.
We have seen that there is a benefit from being immunized against BA2. There's still strong protection levels. It's just that over time your protection levels do fade from around 90% protection against BA2 to 80 to 70 to 60 over time.
On social media, the reinfection numbers have stoked the discord over vaccines, frustrating doctors who argue explaining immunity is about more than one statistic.
The immune system is very, very complicated, unfortunately. It's not as simple as you got it, you'll never get it again.
Studies are being conducted on reinfection, but any real data will take time to collect, leaving much of Canada in COVID status quo. Mike Drolet, Global News, Toronto.